Hello, everyone. I have a patient that I saw yesterday that is battling or facing dental anxiety. And so this particular patient has been coming for quite a few years. And for the most part, we do cleanings. But as far as the treatment that is needed, patient cannot really come to actually terms with the treatment plan and come to actually take care of their teeth. So over the years, I have noticed, and when the patient came, the patient had a lot of issues. The patient had a lot of roots left because the crowns of the teeth have been broken. The patient has issues of impacted wisdom teeth. The patient was in need of a lot of treatment and also has lost a lot of teeth. And so some of them could be treated, and it would need, those teeth would need, lots of those teeth would need a lot of big treatment like crowns, root canals, and such. Obviously, the roots would need to be extracted. And then after that, after all the treatment would be rendered, including some fillings, the patient would then be offered opportunities to restore missing teeth. Okay, but the patient is so anxious that it's very difficult for that particular patient to come and actually get the treatment done. So over the years and yesterday, I noticed that there is a tooth that is now hanging on its last thread. It's going to still be possible to rescue or restore that tooth by having a root canal and then actually having a crown afterwards. But, time is ticking for that particular tooth. Some other teeth are beyond restoration, and some still need crowns and fillings. But the patient, being honest, stated that she was going to try, to actually come back. Yesterday, in fact, we were not able to do the cleaning because the patient was in pain whenever the patient would drink or eat something cold. So doing the cleaning would actually trigger more pain. So we gave the patient medication and then told the patient to come back for the cleaning. And that particular time, we would be able to address some of the treatment. But it would be very important for the patient to go to the specialist, the endodontist, which is a root canal specialist, so that the tooth could be saved, that particular tooth, because if that treatment was not rendered, the patient was in risk of losing that particular tooth. And obviously, that's a very important tooth. In light of everything that is left off, it's going to be an anchor for actually creating bridges, since the patient is so anxious. Okay, but the patient was very honest and stated that she didn't really know if she was going to be able to face their fear. And the patient actually told me what the reason for the anxiety was, and I found that to be very interesting. She said that it was because when she was little, she was taken to the dentist and so many teeth were pulled, and from that time on, she was scared. So that made me think about another one of my friend whose mother was actually a dentist, and he too had teeth removed. And I don't know if it's because, the baby teeth were not really coming out on their own, and mom had to remove those teeth. I don't know what the reason was, but for those reasons, that friend of mine, rather, who's not my patient, has cavities on his front teeth and will not come up to actually going to see a dentist to actually get fillings done. And I told my friend, I said, it looks like if you don't go, you might end up losing those teeth, or you might end up needing, worst case scenario, losing those teeth. But right now it looks like you may need some fillings. Perhaps, you would need a root canal. But because of the past experience, it has been very difficult for that particular friend of mine to go see a dentist, okay? Because of the experience or the trauma that he experienced when he was a child. So before even talking about how to overcome dental anxiety, I wanted to caution parents, right? Because the more you wait, some parents feel like, okay, those are just baby teeth, they're going to fall out. But sometimes, it doesn't quite happen that way. And then the child is put in a position that causes them to be traumatized and to become anxious for life, right? So it's very important for parents to actually take heed of their children's dental health, okay? First of all, parents, you play a major role. I understand that sometimes, say for example, if your baby teeth are impacted, that means that they're not really, because they don't become mobile, they don't fall out on their own. Then a dental intervention by a dentist would need to be rendered, right? But in most cases, it can happen where the child has to now see a dentist. Why? Because we didn't really, as parents, take care of the baby teeth, and now we gave them, or they feasted on candies and juices and all of that. Now they have a lot of caries, and now they need a lot of treatment, and that can be traumatic. Okay, so it's important to make sure that you take care of your children's oral health, okay, because that will prevent a lifetime of anxiety where as an adult your child will start losing teeth because they cannot come to terms about going to a dentist and getting treatment done. They're so scared that things keeps falling apart in their mouth, like that particular patient that I saw yesterday, or that friend that I'm telling you about. So yes, so that's what I wanted to kind of like emphasize on that, because that's where, for those particular people, anxiety came from. It came from their childhood trauma, okay? So now, if you are that person who is anxious, right, what should you do? First of all, try to overcome your fear, okay? Many times you might be scared of going to the dentist, but maybe you don't even have any cavities. Maybe you just need a cleaning. So try to face your fear so that, you can actually go on to having a fantastic dental journey, okay? If you have problems, then it's also not, a reason why you should. If you have anxiety and you have problems, don't be scared, because it can further delay your treatment. It can further make problems even more complicated, okay? So you definitely want to make sure that you go see your dentist regardless. Now, once you face your fear about going to the dentist, and we've seen so many patients at our practice, Healing Wings Dental, where we had been able to bring such comfort to the patient that the patient that was very anxious is now strolling down to the dental practice on their own, whereby before they had to come with someone, they were so scared. So once you are on the dental chair, what you want to do is you want to make sure that you tell your doctor that you are anxious, because when you do so, the doctor is now going to know how to address you, okay? They're going to know how to address you. They're going to know that they need to handle you with care and be extra gentle with you, okay? So it's important for you to actually talk to the doctor about your anxiety. You also want to let them know what happened, because when you actually express yourself, when you actually tell your story, it brings a degree of kind of relief where you have actually expressed yourself, and now you can be heard and you can be helped. Okay, so tell your story and let the doctor know what happened to you, and that's going to help you. That's going to bring your level of anxiety down to some level. Okay, so that's what I would advise you to do. Number one. Number two, you definitely want to bring someone that brings you comfort. That way, they can be with you, and they can also hear out what the doctor is saying and maybe explain it to you. Because sometimes when people are anxious, they might not be listening. The doctor may be talking and it just pass over their head, because all they're thinking about is their anxiety. Okay, so you want to bring a buddy, maybe your parent, maybe your husband, husband or your wife, maybe, a child of yours that brings you, more comfort. Okay. That's something that you can also do. You can also make sure that you bring some earphones so that you can listen to some soothing music, or maybe listen to a book, or whatever, brings you more comfort. Okay. So that's another thing that you can do. Once you express that you're anxious, on the dentist level, you want to make sure that you select a doctor that's very compassionate and that has had experience treating patients who are anxious and who is very caring. Talking about me, for instance, and you can go to our Google review, you will see that many patients state the same thing. It was a friendly environment. The doctor was very understanding. The doctor was compassionate, and all of those. So maybe you can also look at Google reviews to select the doctor that you want to go to. But also, don't try to do everything maybe at once. Perhaps even if you have a list of treatment that needs to be rendered, you may want to do a few things at a time. That way you can kind of like build rapport with the doctor, and also confidence in yourself, and also, telling yourself, okay, it wasn't that bad, and so we are okay. All right. So that's another thing that you can do. You can select a good doctor that you trust, test them out. You can also bring, some music with you, or something that would kind of soothe you. That way it can help. Also, there are many things that the doctor can do. The doctor can offer you nitrous oxide that decreases the level of anxiety, and also, the procedures that can be done where you are sedated. And so if the doctor doesn't offer sedation in the office, they can easily refer you to a doctor that does. Okay. So that's my advice for you as far as techniques or things that you can do to overcome dental anxiety. But by all means, what you don't want to do is just sit back and not face your fear, and not go to the dentist to actually get your treatment done, because all it does is it makes your situation worse. And the last thing you want to do is to lose so many teeth that it becomes so difficult for you to eat. You start losing weight. Also, it can actually take a hit at your level of confidence, right? For aesthetic reasons. And also your quality of life is going to be diminished. Okay. So that's my advice for you today. I'm Dr. Valerie Mukanga with Healing Wings Dental. It is the place where we help our patients regain and maintain their oral health so that they can soar in life, and also brighten their smiles, enlighten their smiles. Okay. We are located at 4101 West Greenox Boulevard, suite number 317 in Arlington, Texas. It is in the big DFW Metroplex, or Dallas-Fort Worth Metroplex. Okay. You can give us a call at 972-213-0202, and we can provide an appointment for you so that we can become part of your dental journey. All right. That being said, please don't hesitate to comment. If you have any question, don't hesitate to contact us. You can jot it down in the chat and we'll answer your questions. And also, please do not hesitate to share this information to your friends and your family members, your coworkers, whoever you know that may be facing dental anxiety and that would benefit from this information. All right. Till we meet next time, you have a fantastic rest of the day. Bye-bye.